Okay.
Okay, so
So you have pancreatic adenocarcinoma?
yes, I was diagnosed in March of 2013. I was at work and experiencing a little bit of pain in between, like right where my ribs meet. I had just started going to the gym again, so I thought at first it was just a pain from something, maybe I pulled a muscle. Um, and after 3 days of being in a fetal position, my husband told me we needed to go to the doctor. We went to the doctor and he thought I had pancreatitis, possibly. From there, he told me to go directly to the hospital, and we went, and I got a sonogram, where they also did blood tests, and they found that my enzymes were very high. There's specific markers for pancreatic cancer, which are CA19 and
CA 125, but they wouldn't know that yet.
CA 125.
First, they tell you
Those markers were high in my blood at the time. So so they wanted to do further testing. They kept me in the hospital overnight, and did a endoscopy where they took a little piece of what they saw on a CT scan, a mass that they saw. They didn't know if it was a cyst or if it was a tumor. When they did the testing came back, it was adenocarcinoma.
Yes. When you cleaned up the table up front, what did you put there? I'm sorry.
It's fine, I can cut that out of the video. The wonders of phone videos nowadays.
So that's how I was originally diagnosed.
And how did you react when you first found out that you were diagnosed?
Kind of shock. I didn't expect any of it, didn't feel any different except for that pain. The pain was wrapping around to my back. So I thought maybe I pulled something at the gym too much or whatever. Never expected a cancer diagnosis. I didn't even know pancreatic, where the pancreas was and what it actually did at the time. Didn't think it was as bad as I was told with diagnosis. I was told that I had a 3% chance of survival, and I would possibly have to have surgery if it was even possible. Went to Sloan Kettering in Manhattan after that because I was diagnosed in New Jersey, and went to Sloan Kettering in Manhattan and went to see a surgeon, Peter Allen, and he originally told me that my tumor, since it was wrapped around the splenic vein, and that's what was causing my pain, it was pressing on the splenic vein and closing the vein, and the vein was what was causing the shooting pains around wrapping to my back, that they could not do surgery. And the only thing they could suggest was chemo to possibly shrink it, and if not, that I was in that bad percentage.
Did they tell you what stage the cancer was in?
They did. They said stage 3 to 4 because if it was operable after chemo, then it would be stage 3. Otherwise, it was stage 4. And at time of diagnosis, I was 42 years old, which was very young for pancreatic to show up. And I actually was very lucky that it showed up and the tumor was where it was, because that's why I exhibited the pain.
You hear about people whose pancreatic cancer is in a spot where they don't know until it's way too late.
It's way too late, and they have a month to live, you know. And so
Did they speak it? Did they give you an estimate of how long you had?
They didn't. They didn't want to. They said since I was young and I was strong and I had no health issues at all, other than that I was possibly a candidate for a new drug that was approved FDA at the time, which is called fulfurinox. Fulfurinox is a cocktail of 4 different chemotherapies. It's very strong, very toxic, and most people who have pancreatic cannot tolerate the toxicity. I came home from the surgeon's office, and a week and a half later I had a port put in. I had port placement. I have one now. It was originally over here, and now it's over here. And that they said that I had to have a port placement because of the toxicity of the medication and the amount of what it would do to my veins if I had it just, a regular IV. It would collapse my veins. So I had to have a port placement, which I did, and I went in for my first chemotherapy. After fulfurinox was given 7 hours in a chair, all different medications, from pre-medications so that it would reduce the side effects of vomiting and nausea and all of that, to the actual chemos. And then I would go home with the last part of the chemo for 2 days, connected. And it would be a portable chemo in a little pack. And that would happen every 2 weeks. I would be on it for 3 days. Then I would get a shot, which was for my immunotherapy or my immune system, to boost my immune system and boost my white blood count. And that shot was called Neulasta. The Neulasta, I felt during chemo, was probably one of the worst of the side effects. I did not have many of the side effects in the beginning. I did not have nausea. I didn't have any vomiting. I did not lose my hair. What I did get eventually was neuropathy, but that happened a while later. The Neulasta shot was worse because it felt like as if you had the flu times 100. All your bones would ache, and I had back pain and bone pain, and it was from the actual cells multiplying from the shot quickly, rapidly, so that I wouldn't get sick from anybody who walked in or coughed or sneezed near me or anything like that. So I did the fulfurinox for about 3 treatments, and I went to my doctor, and I really couldn't eat during this time. Anything that I ate was it was bothering my stomach. Not that I would get sick, but it just made my stomach feel acidy and almost like acid reflux. And 3 weeks later, I felt good on a day off from chemo, and I decided to make pizza for the family. And I actually ate the pizza, and I told the doctor that I made pizza and ate it, and he's like, wow, you're taking the enzymes that I gave you. And he had prescribed enzymes for the pancreas, which I actually never took. I never took one of the pills. I'm not a pill person. I don't like to take pills, so I did not ever take them. And when he said, wow, the enzymes are really working, and I said I never took the enzyme, he had a smile on his face from ear to ear, and he ordered a CT scan. When he ordered the CT scan, we found out that the tumor had shrunk to where they couldn't see it at all. And that I was now a candidate for a surgery.
So did you go through with the surgery?
I went through with the surgery. Initially, I thought I was going to have to have a Whipple surgery. That's what it's called, where they connect your pancreas to your other organs, and then you have to be on all sorts of medication. You can become diabetic from it. But as it turns out, I did not have to. I had a distal pancreatectomy, where they took part of the body and the tail of the pancreas, and they got clean margins. And I have about a little bit more than a quarter of my pancreas, which is functioning as if I have a full pancreas.
So so that one small portion is
portion is acting as if I have the whole thing.
Overdrive constantly.
It's overdrive. I'm not on any. I was not, and I'm still not on any medications for that. I don't take any enzymes, or I'm not diabetic. They called it the miracle. In that surgery also, they took out my spleen because it was very close to, and it could spread too, and it's not needed, so they removed it. So what I have to do is now get, every 5 years I have to get a pneumonia shot, the inoculation for that, and I have to get the flu shot every year. But other than that, I haven't even been great with the flu shot. I haven't done that.
Who is?
So, so that happened, and I went, after surgery, I recovered for the summer, July and August, and in September, I went back and did 6 rounds of FOLFIRINOX again, just to make sure that any cells that got out, that it would kind of catch and kill.
So you went into remission?
I went into remission. I was in remission for approximately 2 years, where I was on no chemo at all. And then in, I want to say 2015, between 2015 16, I experienced, I had CAT scans, and I had regular CAT scans that whole time, and they were doing them every 6 months after I was cleared. In one of the CAT scans in 2015 16, around there, they saw on my ovary a small mass. They didn't know if it was cystic, because of my age. So they were watching it at first, and then it grew from 3 centimeters to almost 12 centimeters, like a grapefruit, on my right ovary. I went in to have that cyst removed, and it turned out that it was pancreatic, and it did come back, and it came back to the ovary. Pancreatic is not known to come to the ovaries.
It's not known to move very much at all.
Pancreatic normally goes to the lungs, to the to the liver, to the lungs. It can, and goes into the gastric, the stomach lining.
Basically the digestive system.
Yes.
And the things connected to that.
Right. And so that it went to the ovary, everybody was like, hallelujah, we could take this out. So they took it out. I had a complete hysterectomy in 2 years ago. So 2016, May 2016. And I had my appendix removed at the same time because it was close, and they took that too. Surgery was very difficult. after healing, went back on fulfurinox. Also went on oral. One of the medications in the fulfurinox was, it's called 5FU. And I think the name is capecitabine. And they were allowing me to take that orally rather than taking it by the pump. And that turned out a couple months later, did a CT scan, and they found on the vaginal cuff, they found a small fluid-filled, they still don't say it's a tumor, but that's pretty much what it is. And so the capecitabine wasn't working, went back on fulfurinox. Fulfurinox has worked for me for many years. I probably did about 8 cycles of it, and it showed that it was starting to grow. The tumor was starting to grow. So we stopped, and the side effects of the fulfurinox were finally hitting me. Where 5 years being on a very toxic medication was making my fingers numb and tingly, my toes, very weak and tired.
I think I heard something about not being able to touch certain things.
When the first week of being on fulfurinox, you can't touch anything cold. It's one of the medications that's in the cocktail. You can't touch it. You can't drink anything cold. Otherwise, you feel like you're choking. If you touch something cold, you automatically drop it. But that was the whole time. I don't know. I forgot to mention that. That was the whole time during fulfurinox, but it got really bad towards the end. And the Neulasta shot was also doing its number on me. They had to reduce the dosage. It was only at half because I couldn't handle the pain in the bones anymore. My body, after the surgeries and everything else, got weak, and the chemo together. So now...
So, why did you choose more hair loss inducing treatments, or now?
The medication that I'm on now is called gemcitabine and Abraxane. They're 2 medications actually mixed. I had the option of just doing gemcitabine without the Abraxane. The Abraxane is the one which has more side effects, and it does make you lose your hair. I have a 10-year-old son, and I decided that both medications I feel will work better and give it the 1-2 punch that it needs to put me back into remission with both medications. So I chose to do that and lose the hair rather than get maybe a year or 2 and not be here to see my son, my 10-year-old. So the hair loss was a big deal with me because I never had the hair loss before, and I always I stayed on the fulfurinox longer than I should have because of that. I didn't want to lose my hair because I didn't want the little sign over my head saying that I had cancer. You would never know to look at me prior to 2 months ago that I had cancer at all. But now I feel like it's there's a little blinking neon light over my head going, guess what? I have cancer! Even with a wig and all that, it's difficult. And it's difficult with the 10-year-old asking a lot of questions and being fearful and scared and seeing his mother change a lot. And so we're dealing with all that now, and it is okay, and with counseling and great friends and support, we have help with that, but I was trying to avoid that. Now, next week I have a scan coming up to see if these two medications to get together gave it the punch it needed.
What day next week?
Thursday.
That's the day after my presentation.
Yeah, well, that's the day. Thursday, I will have the scan, and I probably won't know until the Monday after, but I will let you know how it's working. My doctor said that the gemcitabine alone probably would have done what it needed to do, but he thought that because I was still strong enough to handle fulfurinox that this was a breeze. Gemcitabine they normally give to the older people who have pancreatic, and it's something that they can tolerate. The two together are a little rough. The side effects for this one are becoming very tired, rashes, dry mouth, and sores in your mouth. You still do get muscle pain, but not like the Neulasta, and I don't have to take that shot right now because this one is not as toxic. And the blood counts are this medication lowers your white blood cell count and your red blood cell count. So sometimes I will have some bleeding vaginally that comes out because of the blood is so thin.
Have you had any other effects on your daily life besides like the physical effects? Like, has it made anything harder that you wouldn't have expected to be harder?
Just getting out of bed sometimes is hard. You know, like on a treatment week especially, because this treatment is different. I only sit in the chair for 2 hours and get my chemo. But the 2 days following or 3 days following, I'm very tired. And I feel like just getting up and making dinner or doing laundry or doing homework with my son, I'm exhausted. And I deflect a lot to my husband. I don't drive during treatment weeks. I don't like to drive because I'm allowed to, but I don't because I don't feel like I'm on point. So yeah, it has changed some stuff that I normally would do. And also going out. Right now I'm not so comfortable going out without my hair. I do have a wig, and I did go out last night for my son's 10th birthday, but I didn't feel very comfortable.
Okay. Thank you for
You're
having
welcome.
the interview with me.
You're welcome. Good?